started. Okay, so for those of you who don't know me, I'm Chaya Hagler. I'm a birth doula, massage therapist, birth educator, etc. I had the privilege of meeting Aliza about a year ago, and we instantly had so much to talk about, being that we're both so passionate about women's health and postpartum recovery and many other things. So thank you so much, Aliza. Can you tell us a little bit about yourself?
Yeah, thank you for having me. It's really exciting for me. So, I am a physical therapist. I specialize in women's health. I really love specifically working with the postpartum population. I would say I'm slightly unique in how I treat, in the sense that instead of kind of doing only traditional pelvic floor therapy, I like to have more of a whole body approach where I kind of incorporate within pelvic floor therapy also orthopedics and sports medicine and lifestyle education and things like that. And I'm also really into preventative care and health and wellness. And I really like talking to moms about their emotional health in terms of like, so many emotional things can come up when you're a mom in terms of stress and dealing with your emotions and kind of navigating that identity shift to becoming a mom. So I also really like talking about that kind of stuff.
For sure. I love that.
Yeah.
The holistic approach.
Yeah. Yeah.
Yeah, so something I noticed over the years as a doula is how much one's labor and birth experience can affect both the emotional and physical parts of their recovery. From your experience, have you seen this correlation, and can you tell us a little bit more about that?
Yeah, definitely. Can you see me, by the way?
Yes,
Okay.
very
My arm
exciting.
is so numb after this. Sorry if it's moving a lot. Um, yeah, I think that's a really good question. So in terms of just physical things that can happen with childbirth, I mean, there's definitely a correlation between, like, there's even in the research things like instrument assisted delivery and things like that, how that can put someone more at risk for pelvic floor dysfunction. And we know if someone had an episiotomy or a cesarean section, like they might need special considerations for certain things. So there's that physical part, there's definitely a correlation. And I really like how you also brought up that emotional piece as well, because childbirth is like a very personal experience. And if it doesn't go the way someone wants it to, and they might even consider it like traumatic, right? Whatever that means, because trauma means different things to different people, that they can really hold those feelings for a long time. And it can affect their personal relationship, their interpersonal relationship. So there definitely is a correlation between what happens actually at childbirth and then what we see manifest later on.
Yeah, for
Hmm.
sure.
Yeah.
So many of us who are in the women's health field know what a placenta looks like and have seen it, probably seen it many times. Though many women who have given birth don't know much about it or don't even want to see it. So when you actually realize the size of the placenta and how we have a scab on our uterus of that size, post birth, it's so eye-opening. Can you tell us a little
Hmm.
more about that and why that's so significant to postpartum recovery?
Yeah. Well, firstly, the first time I saw my placenta, it was definitely eye-opening. Like that huge thing was in me. I mean, for sure. I mean, I just even remember when after I had my kid and I was like, I'm done. They're like, okay, now push again. I'm like, are you kidding me? I did
Yeah.
this so I definitely totally hear what you're talking about. I think it's I'm not going to talk specifically about the placenta, but I think that's a really good question in terms of like understanding what your body actually went through and the actual physiological changes that it goes through when you're pregnant that people don't necessarily know or just don't appreciate because they're just not, they haven't been educated on it. But for example, the uterus, it like expands 15 times its normal size about, and you have a blood volume gain of around 40 to 50%. I mean, that these are huge changes that happen amongst many other things. And it can take a while, like 4 to 6 weeks, for things to start shrinking back down to their normal size. Same with the placenta scab that you're talking about. So I think it just paints this picture of we really need to understand and appreciate this healing process that the body went through a lot of changes and it's it's like not to our advantage to start jumping right back into high activity and things like that, because the body needs to heal, whether it's from that physical point, or even like there's a lot of pressure on social media for people to look and feel a certain way right after having kids, right? Pictures of someone, showing like, this is how my body looks like 2 weeks after having kids. And but if you really think about it, like I said, it takes 4 to 6 weeks for even stuff to start shrinking back down to normal. So it's actually really normal for your body to still look pregnant right after having kids. And I think people don't realize that. But the more you understand about the changes that happen, the more you appreciate and respect that healing process that needs to occur afterwards.
Yeah. Yeah, true. I mean, there's so much focus on that external recovery when there's also all
Yeah,
that internal stuff going on that many people just don't even realize. So I think
yeah,
it's
exactly.
a big piece. So this next questions, it's like a two-part question, kind of goes along with what you were already saying. I get to see many women at the postpartum stages through my line of work. Every now and then I hear a woman, I mean, more often than not, actually, they tell me how they feel so great and they feel ready to exercise and walk around. What would your advice be to someone that feels that way? And the second part of the question is, how can we balance that with making sure not to overdo it, even when feeling so good, to help prevent it from, backfiring?
Okay, good. I'll try to combine the two questions, but if I miss one, just
That's
remind
fine.
me. And can you guys still see me?
Yes.
Okay, good, good. Okay, yeah, the talking about exercise postpartum is like, I find one of the most confusing topics for moms, because there's just such a lack of knowledge out there. So like, at least in the US, there's kind of this like, before 6 weeks, like you do nothing, and after 6 weeks, you can do everything type of mentality. That's what people are told, without a lot of room for gray. But really, there's so much gray in between that. And like I said, that's one of the most confusing topics, because there aren't clear cut guidelines in terms of what you can or can't do before 6 weeks or after 6 weeks. I mean, they're starting to come out with more. Like, there's a group of physical therapists who came out with guidelines for returning to running postpartum. So there's like some things coming out, but besides for that, there really isn't anything clear cut. So I just did want to kind of, before I answer the question, just validate people who are feeling really confused, because it is one of the topics that I hear from people where they're really most confused about.
Yeah.
So taking in the mindset of it being a lot more gray, like what can you do before 6 weeks? What can you do after 6 weeks? Because before that 6 week time, we don't want to just be lying in bed all day long, right? We want our body to be moving. Movement is so important. But I think the key things to think about when you're talking about making sure that we're not working ourselves too hard is that time is a time where things need to be gentle, and we need to think about how can we nourish our body and how can we help promote that healing process. So certain things that are gentle are really okay unless someone has any type of contraindication to them. But things like starting a gentle walking program, doing like gentle stretching or mobility work, learning how to connect to your pelvic floor and your abdominal muscles, breathing, posture and alignment, like all of those kind of things are really great ways to get the body moving and just set things up for success, but not working yourself too hard. Because if you work yourself too hard, and I mean, people like this, I know people like this, if you're someone listening, if you're like this, like that person who it's like you're 3 weeks postpartum and you're doing a cardio video, or like don't tell mom kind of thing, right? So working yourself too hard can really push back the healing time and can prolong that healing process. So it is definitely like just to kind of recap, movement is really important, and setting things up for success is really important, but we also have to be mindful that we're not pushing ourselves too hard. Um, and when it comes to after the 6 weeks, so firstly, I'm really going to be curious about what happens in the future in terms of like this 6 weeks, right? Like I feel like that's going to change, because the guidelines that came out for running is saying how really someone shouldn't even start running until they're more like 12 weeks postpartum. assuming that they don't have any type of symptoms also. So I'm just kind of curious what's going to happen if 6 weeks is going to end up being a thing or not. But so I like to think of it in terms of, since we don't have guidelines right now, in terms of like exercise intolerance. So if you've been cleared for exercise and you're doing something, is your body showing any signs of intolerance to it? So that could be things like, are you having any leaking with like jumping or sneezing or the exercise that you're doing, running? Do you have any type of pain, like pelvic pain, abdominal pain, knee pain, low back pain, anything like that? Do you have any feelings of like pressure or heaviness in the vaginal area, which could potentially mean a prolapse? That's like another thing. Do you notice that your stomach is like really excessively bulging out, which could be a sign of having that gap between the stomach muscles, that diastasis? So I think the more mindful you can be and listening to what's going on in your body, that can be really helpful. So if you do have any of these signs of intolerance, then that's your body telling you that, let's take a step back. Let's contact someone who is knowledgeable in postpartum recovery and find out what's going on. So I think that can be a really good way to feel educated about what you're doing and to know if you're working yourself in a way that maybe your body's not ready for.
Yeah. I mean, I love that piece about really having to be in touch with ourselves, really tuning into our bodies, because I think that's so important in general. And then as a new mom, that can like help us not lose our identity and really protect ourselves as individuals. And between that emotional and physical part of recovery, I think that tuning in with your body really plays a part. Getting the rest you need when you need it, getting that movement in when you need it, getting that good nutrition in because your body needs it. Like it's really like full circle, right?
Yeah, I mean, I could talk. I know that's not really the topic right now, but I could talk about that forever. I mean, completely. A huge thing is that after having kids, we do a lot of women, myself included. Like I know I felt really disconnected from my body, so that's really one of the first foundational steps, is just to learn how to connect to your body again, so you can really be in touch with what's going on and everything, both from a physical point of view and that emotional point of view.
Yeah, I mean, I feel like we can have a whole conversation just on that because I mean, it goes even before, like during pregnancy, you want to be tuned in, and throughout labor and birth and the postpartum period, it's so important to have that mindfulness, and if you don't know how to really learn to and tuning in with your body. So,
well, I just had a whole interview in my Facebook group with someone where he spoke all about that, tuning in and self-care, and yeah, it's a huge, really important topic. Definitely,
I have to listen to that because it's probably right up my alley.
Yeah, you would like.
Yeah, I'm sure. So this next question is pretty relevant to many of us postpartum. What about healing from a tear or a episiotomy? What are some things that we can do for ourselves, both emotionally and physically, if that did happen to us?
Yeah. Well, I definitely think when we talk about things like episiotomy or tearing, I mean, even cesarean section, it's always a really good idea to reach out to a pelvic floor therapist or someone who is knowledgeable in those kind of things. Again, talking about preventative care, maybe even if you're not having pain, but especially if you are, that preventative care, because that can really help set you up for success and prevent things from happening in the future. Like one really big thing is scar tissue massage, right? I mean, how many people have been told to do a scar tissue massage after an episiotomy or a cesarean section?
Right.
I would say most, if not all, of the women I've worked with they never even really heard of that as a concept, at least from their healthcare providers. Maybe they heard of it from somewhere
Their
else.
doula, if you have a doula, you know about it.
Yeah, and unfortunately, not everyone has a doula. I think doulas are amazing. Not everyone is even familiar with what a doula is. So there's definitely education when it comes to that in terms of things like scar tissue massage. If they have any type of pelvic floor tightness or pain, then learning pelvic floor relaxation techniques and things like that can also be really important to help with that. But the more education you have, the better someone's going to feel, right? So I definitely think reaching out is really important. And also just talking about, whenever we talk about tissue healing, right? You had a scar. The body has to go through those stages of tissue healing. So that's also important to know, because we have to, like, talking about looking at things a little bit more holistically, right? We have to do whatever we can to help the body to be in that healing state.
Yeah.
Looking at things like, what is someone's nutrition like, right? Because, you and I both know that nutrition plays such a key role in tissue healing. What's someone's sleep like? What is their stress levels like? Because all those things, if someone is, let's say, in a chronic stressful state, the body's going to have a very hard time healing because it's not in a healing state.
Right.
So taking that more holistic approach and looking at what's going on within the whole body is also really important when it comes to any type of tissue healing.
Yeah. And I think there's like so much fear of I think in general, people have fear of the unknown. So I think that piece where you said, the more you educate yourself, even beforehand. So a lot of it will help with the preventative, but even if you are educated on, what you should be feeling, what you shouldn't be feeling, what you should be doing for your body to help with the healing process is huge. So education is key.
Yeah, it's so true. I mean, I always say, like, I'm a physical therapist, but I'm first and foremost an educator, because I believe so strongly in education. And that's actually, I think, what I love most about what I do, is just giving that education to people.
Yeah, for sure.
Yeah.
I relate to that. Should I quickly say what a doula is? You said people don't know. Okay.
Yeah.
Just like a tiny brief definition of what a doula is. It's someone who's there for emotional, informational, and physical support throughout the pregnancy, labor, birth, and immediate postpartum stage. So it's someone who's really there for you guys, someone who's there constantly, not a doctor that's just coming in when there's an emergency or to catch your baby, and not a nurse who's coming in and out. It's someone who's there just for you and, learns what your birth plan is. So they are working with what you are wanting and working with your goals. So that's just like a tiny brief, for people who don't know what a doula is.
Even like do it justice, because I think about like my doula, the important role she had. It's definitely people who aren't familiar with doulas, it's really worthwhile to look more into what they do.
Yeah, I agree. Okay, so many women think that if they don't go through a vaginal birth and they go through a cesarean birth, that they don't deal with the pelvic floor pain. So is that true? And if not, can you tell us more about that? Like, some people might be surprised or really don't know what to expect. If they have a cesarean birth, they just think they avoid all of that vaginal stuff and pelvic floor stuff. So
yeah,
tell us a little.
Can you still see me, by the way?
Yes.
Okay. I'm like nervous to move right now.
Oh,
it's like my feet are... No, it's fine. So yeah, that's a great question. So there's actually been some research kind of showing where, I don't remember the exact numbers, but pregnancy in and of itself can potentially lead to some pelvic floor dysfunctions, just the nature of being pregnant, not even the method of delivery. But that is to say that people who do have vaginal deliveries are at a higher risk, you can say, for pelvic floor dysfunctions. But even someone who had a cesarean section can potentially have it. So I think that is definitely a good point for people to keep in mind, that they're not like scot-free of any type of pelvic floor if they had a cesarean section, because you really have, there's so many different reasons why someone could have a pelvic floor dysfunction. And even sometimes like a cesarean birth, a C-section, could even potentially relate to that, right? Like if someone has a C-section, they have scar tissue, and they have a lot of scar tissue and a lot of abdominal adhesions, that's going to make it much more difficult for the pelvic floor to work optimally. Or if someone has really weak abdominal muscles, right, then the body's not getting stability from the abdominal muscles, so it might overcompensate by trying to really grip a lot with the pelvic floor, and then that can cause pelvic floor tightness. So that idea of pelvic pain can really take some deep diving into why someone has pelvic pain. it's not always related even just to the pelvic floor, right? Like I mentioned, it could be something going on in the abdominal muscles or in the hip muscles. It could be lifestyle related. If they hold a lot of tension in their body, they could be holding a lot of tension in their pelvic floor. We spoke about nutrition, right? Sleep habits, stress, looking at medication use, right? It's hormonal birth control. A lot of times could cause someone to have pelvic pain. So it really, pelvic pain is really like a huge topic in and of itself. And what could be causing, like finding the why for that pelvic pain could take some digging. So I think just to kind of, it was like a little bit of a roundabout, slightly tangent to kind of answer to your question, but so having a cesarean section doesn't mean, like I said, that they won't ever have a pelvic floor dysfunction, and it could potentially be related or not be related. So that's I know there's a little bit of like a roundabout.
Yeah, no. So basically, it's normal to feel pain even if you haven't had a vaginal birth. I mean, I'm sure even if you haven't had a child at all, but after cesarean, I think people think, oh, they avoid all that.
Right. Yeah. So yeah, it's definitely, if someone has pelvic pain and they had a cesarean section, they are not alone in that. Yeah, that can definitely happen.
And I'm sure, like, I'm just like thinking about this now, that I'm sure it affects things like if someone goes through labor or pushing, and doesn't end up having that vaginal birth, but they've still used a lot of those muscles, and I'm sure that also affects things.
Yeah, definitely, yeah.
So I want to hear your opinion on this next thing. Why you think pelvic floor PT is so common in other countries and a normal part of regular postpartum recovery there. Like, I've worked with clients in the past that are, European and have had their first babies in Europe, and it was a normal part of postpartum recovery. It was covered by whatever their, healthcare. They didn't have to pay for it. And that was a normal part. Everyone went to pelvic floor PT as part of recovery. Why is there less awareness here in America, and what can we do to increase that awareness and the normalcy of it? So that's like a few questions in one.
Yeah. I mean, I will say that I haven't done like a sociological study on comparing America to other countries, so I can't really answer the question why it's different in America than other countries. It could be
why you might think. Why do you think?
Yeah. I mean, to be honest, I mean, it's hard for me to even answer that. Why do I think? Because there's so many political and different things going involved. But it is interesting to think about, though, how America is. It seems almost like that our support for moms really isn't that great.
Yeah.
I mean, besides for postpartum pelvic PT, like not even being mentioned a lot of times, and a lot of these things not even being mentioned. A lot of people only have 6 weeks for maternity leave. A lot of times it's not even paid.
And that's in America, not in these other countries. So I guess it's
So
an all around issue. We're like,
yeah. So there's definitely a lack in trying to serve postpartum women and trying to serve mothers in America. 100%. I remember when I was in the airport. Now it's better, but like this was even a few years ago, and there wasn't a place to nurse my kid. She was like, "Go use the bathroom." I was like, I don't want to like nurse my kid in the
You wouldn't want to eat in the bathroom.
Right, exactly. So I mean, now there's more things coming up in the airports, but it's really moving slowly, really slowly. There definitely is a movement, but it's taking its time to get there. And it really is interesting to think about and to hear about other countries and the more support that they have for a postpartum woman there. But for example, the American College of Obstetrics and Gynecologists came out with something and kind of recently where they're starting to say that women do need more care than just that 6-week checkup. So there's definitely a move in the right direction. There's that whole 4th trimester type of movement. There's definitely things that are happening. I think though that in America we're kind of in this stage of like you really need to be an advocate for yourself. like, if you feel like something's wrong or you want to be educated, you really might not be getting that from your healthcare providers.
Yeah.
So you might need to do your own research. You might need to try to find people who you can talk to about things and you can get educated. And then you have to bring that up at your appointments and you
Yeah.
have to try to find people. That's kind of the place we're in right now, because there are people out there who really want to help. I mean, I am part of like a large network of physical therapists that are really trying to advocate for women and create programming. There's like some programming starting in hospitals, even like as soon as a woman gives birth, like when she's in the hospital, she'll have a PT visit. So there's definitely things that are happening. And like me personally, like I told you I'm really into preventative care, so I offer like newly postpartum consultations. Like you just had a baby maybe a week or two ago. Let's talk about education. Let's talk about how you can get started on the right foot. So there's definitely people out there who are trying to push for these things. It's just not part of our like legislation yet.
Yeah. I mean, I think it's great that there is becoming more of that awareness. And I think it really starts with us as women. Like, enough of that struggling alone, right? Like we all go through this stuff. So I think the more we talk about it and the more awareness that we bring out, the more we're going to create that change. I mean, I think.
Yeah, definitely. Definitely. We definitely need to be advocates and we need to stick together. I think that's really important. Sometimes there's like people get a little bit about their own businesses, like my way or the highway, or a little bit cat and mouse with certain things. But I think the more that we stick together and we really advocate for each other, the more we can make change.
Yeah, I agree.
Okay, tell me if you can still see me, because I need to change positions.
Yeah, I mean, I think whatever was happening in the beginning, like, it resolved itself. So stretch if you need to.
I sit like this?
Yeah, no, this works. So yeah.
Okay, good.
We tend to hear about what is considered quote unquote normal postpartum pain during recovery and postpartum month. Can you share what is actually considered normal and what is really not normal, but has just become normal because so many women are dealing with it? I mean, I know this, from dealing with my clients, but it's also something that we hear so much of. And I would just love to hear your, take on that. And
That's a really, really good question. So let's differentiate between the difference between common versus normal.
Yeah.
So things like, what are things that are super common after giving birth, right? Even people don't talk about it. Like a lot of times when I speak to people, they'll say, I didn't realize other people have this, but they do. It's just they don't talk about it. So what are things which are really common that can happen after giving birth? That's things like leaking with sneezing, coughing, jumping, running, all that kind of stuff, or urinary frequency. Like, maybe before you had kids, you only had to go to the bathroom once every 3 hours, and now it's like every hour, every half hour you go into the bathroom. That stuff is common. What else is common? Pain with sexual activities is common. Like having a prolapse, which is like, basically, just to explain in a super nutshell, if you imagine like a hammock between two trees. So imagine the pelvic floor being the hammock, and if the pelvic floor gets a little bit overstretched, then the hammock starts drooping down. So actually the internal organs can start kind of either coming down or kind of outpouching into that vaginal canal. That's super in a nutshell, what a prolapse is. So prolapse is really common. GI issues like constipation are really common. So there's a lot of things that are common after having kids, but they're not normal, right? I mean, you might even see there's like commercials now about like wear these pads so you can go running and you'll feel empowered that you could run again after having kids. But I actually don't really like those messages because it's normalizing that experience.
It's not normal, right?
Yeah, having leaking it's common, but it's not normal. It's your body telling you that something isn't resolved, there's something going on, and that it should be addressed. And that's the same with everything that I mentioned. So there's definitely that need to understand common versus normal. And if you are having something, it is really important to reach out and to get help so that you don't have to live with it. right? Just because there are these commercials out there and people say, like I've seen, pictures on social media, like, who can't jump on a trampoline anymore because you had kids? And it's like, yeah, oh, yeah, right. But you don't have to live like that.
Right.
It's very easy to get help, and it is definitely something that can be addressed. So I think that's a really, really important question
Yeah. I
that
mean,
you brought up. Mhm.
it's huge.
Yeah.
Well, what would you say to someone like, what is considered within the parameters of normal? Like, what's that time frame of like normal postpartum pain versus this has become something that's not normal?
Yeah, yeah,
Or
that's a good
symptoms,
question.
pain symptoms. Yeah.
Yeah, so immediately postpartum, someone might have some type of symptoms, like especially, let's say, pain with intercourse. That's really common to happen, like, the first time, and or pain with penetration, I should say, or even, the subsequent times. Um, but it's something that should get better, right? And that's kind of the same thing with other things. Someone might have some, maybe some leaking or something, but things should really resolve. And if they don't resolve, then definitely you should reach out for help. But even having it, like even if someone's having leaking, um, that in and of itself could be an indication. Like it's just something to watch if you have it immediately postpartum, just in case it's something that's, you're noticing that it's getting worse or it's not resolving, right? So that's something really important. That feeling of pressure or heaviness, which could, or feeling like something's bulging down into the vaginal canal, which can indicate more of like a prolapse. That's something to watch, right? Because maybe someone might have that feeling after you just had a baby, right? Everything's kind of hanging loose anyways. But does that feeling resolve? Or like with your stomach muscles, right? Like, feel like maybe you might think you might have like a little bit of that diastasis, that gap between the abdominal muscles, which is really common to have postpartum. I mean, they say that one study says that even 100% of women have a diastasis in their third trimester, right? So it's super common, 100% common, but we were talking about before, kind of being mindful of what's going on in your body. So, definitely if something's getting worse, you want to reach out. I mean, if someone's still having symptoms by 6 weeks, for sure by 12 weeks and things like that, you want to reach out. But like I mentioned, I'm really into preventative care. So I think it's actually really important for people to reach out to someone pretty much just after having a baby, like even 1 to 2 weeks, just so they can get that education. They can be evaluated to see what does their breathing look like, what does their posture look like, can they connect to their pelvic floor, can they connect to their abdominal muscles,
Yeah.
so that they're really setting themselves on the right track, and they can ask questions, right? Someone can say, I'm having leaking at 2 weeks, like, is that normal, is that not normal?
Yeah. So
Yeah.
I think the overall message is really that same tuning in with your body, knowing what, not ignoring pain, not ignoring something that is just like, this is normal, or this is what my neighbors and friends are dealing with. So I know it's considered normal. Like, no, don't ignore that pain. Like, it is not normal. And preventative is also so key. I know as a doula, I try and, educate, and I'm a big proponent for pelvic floor PT, and also again, that education to help with that preventative, to help prevent some of this. And at least even the education piece, even if it doesn't prevent, but when you are educated, you know what is normal, what is not normal, what to look out for, what can I do to help myself. So not ignoring any of that. I think that there's so much of that, like, hush, hush, this is embarrassing, not wanting to talk about it, keeping it to yourself, or just thinking it's normal. So I think it's just so, so important. And like we said at the beginning, that postpartum recovery is huge as far as not only your physical recovery, but your emotional recovery. So, and that's a big, big piece. So, yeah.
Yeah, 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 definitely, for sure.
So you kind of mentioned this in in your past answer, but when would you say if someone did want to see a pelvic floor PT, when's that optimal time to seek out pelvic floor PT?
Yeah, no, that's a good question. So like I mentioned, I'm really into preventative health.
Yeah.
So I really think that people should that it actually would be good to have like a consultation pretty much right after having birth, like 1 to 2 weeks. just to make sure you're setting yourself up on the right spot, because we spoke about how the body changes a lot when you're pregnant. And I think people a lot of times don't appreciate those changes,
Yeah.
right? And then they just go back to their daily activities without trying to connect to their body again. So it's like if someone sprains their ankle and they're an athlete and they never really did rehab for it, and then they just go right back to whatever they were doing, running a marathon, whatever activity they were doing, right? And but just the changes could affect their activities. So when we really appreciate how much the body goes through pregnancy, we realize how much we really need to, talking about tuning in, we really need to connect back into our body. So I actually really think it's a good idea for people to reach out for a consult pretty much right away, just to kind of look at those foundational things, like what does your breathing look like? What does your alignment look like? How are you connecting to your abdominal muscles? How are you connecting to your pelvic floor? How are your body mechanics, right? How are you picking up your kids? How are you moving? All those kind of things to really set someone up in the right space. And then also to talk about things like health stuff, like, are you having any leaking? Are you having any pain in general, or pain with intercourse? Do you might have like that diastasis, that split between the abdominal muscles? Do you have any constipation? So I really think that preventative care is so key, for sure. And not every therapist offers that, but there are definitely people that do offer it. But then also, let's say someone's past that stage. So really, I mean, anytime, especially once you're cleared by your doctor, then for sure you can go to a pelvic floor PT if you're still having pain or anything. So for sure, if anyone's having any of those, like I kind of mentioned, signs of intolerance, like leaking or pain or noticing a diastasis, or those feelings of maybe having a prolapse, for sure someone can go, definitely. I don't think there really is like a set time you could only go see someone at this time or at this time. It could be the earlier you go, they might not do as much with you.
Yeah.
Depending on what it is, right? Like if you're only 4 weeks postpartum, I'm not going to have you running on a treadmill. But yeah, really going anytime. There isn't really a set time for it.
Yeah.
Yeah.
That's good to know, because I think a lot of people think only in the case of where I'm struggling with that recovery and I'm in so much immense pain, do I then seek out a pelvic floor PT. So I think you even can save yourself money when you have the preventative care, right?
Yeah, you don't want to wait until you're in like chronic pain.
Yeah.
This you can go, and it's actually, with a lot of people I've worked with, there's almost like this sense of relief when they finally start talking about it, finally start getting it addressed. Like if I've worked with someone who've had something going on for years, and then it's like, it's like I can hear this just like relief of finally taking care of it, and how much their quality of life improves when they do take care of something.
Yeah.
So the sooner you can get in, the better, really.
Yeah.
Yeah.
I agree. So here's a question that we didn't exactly plan for, but I would love to address is, what about that myth, or is it a myth, that if you do Kegels throughout your pregnancy, that it'll help prevent tearing or it'll help strengthen your pelvic floor? Is that the right advice that women should be getting, or is there really more that they should know regarding pelvic floor exercises and stuff? I don't know if you want to answer this right now, but
Yeah, no, for sure. No, it's a really good question. There's a lot of myths around Kegels. I did like a whole video in my group specifically about Kegels, because there's a lot of myths with it. Well, I think first of all, I'll just say some. I'll kind of say some of the myths and kind of bring in what I was going to say. But so I think people do have to realize with any like exercise program how individualized it has to be. So firstly, just to kind of, I'll just set the framework of what actually a Kegel is, because most people, and this is even in the research, don't actually do a Kegel correctly. So what, and again, I did a whole video on this, so I'm not gonna like go
Yeah.
into so much detail, just to kind of give a little bit of a framework. I like to think of a Kegel like an elevator. So let's imagine like the lobby to floor 5, right? So what a Kegel actually is that um, there's like an there's it's a contraction and a lift, right? Some people think it's just the squeeze, but there's a squeeze and a lift, and then there's that relaxation. And you need to have all of that, just like with any muscle that you move, right? Like, and if you can see my arm, like my biceps, right? There's a bicep, you shorten the muscle, there's a bicep curl, and then there's a lengthening, right? You need to have like the whole thing. So it's the same with the Kegel. You need to have all of that, the contraction, the lift, and the relaxation. So a lot of times what the mistake people make is that they think of it only with the contraction, and they tighten and they tighten and they tighten, but they never relax the muscle. So that's something that can happen in childbirth, where Kegels are definitely important, but especially when someone's getting to that 3rd trimester, they need to learn, and especially even beforehand, again, it's person dependent if they need more relaxation in general, but especially, in that 3rd trimester, learning that those relaxation techniques also, which is going to be really important for childbirth. So that's one big thing, is that you need to have all of that to do a proper Kegel, and that some people actually are not appropriate candidates for a Kegel. It's another huge myth. Like I heard from even their doctors, where if they had a pelvic floor issue, the doctor says just do Kegels, but sometimes Kegels can actually make it worse, because if you think of that traditional Kegel, right, which is just the squeeze and the lift, right, that's the traditional part, then if your muscle is already tight, you're asking it to tighten even more, right? Like if someone has a hamstring strain or something, we're not going to then ask them to do all these hamstring exercises, because it's going to make it even more tight. So if someone has any type of pelvic floor tightness, which can manifest in like pelvic pain, pain with intercourse, even let's say hip pain, low back pain, things like that, or if they're like just in general a pretty tense person, holds a lot of tension in their muscles, then there's a good chance their pelvic floor is tight. So you actually don't want to be doing Kegels, because you can be making it even more tight. So instead, you're really focusing just more on the relaxation part of the Kegel, until you can really start doing more of that, that strengthening. So that's a really, really good question. About the Kegels. So number one, not everyone is appropriate for them. Number two, you really have to focus on the relaxation part of it. That's a huge piece that's missing a lot.
Yeah.
And then also just making it functional, I think, because people think of Kegels as like an isolated exercise. Like, let me just do Kegels when I'm at a stoplight, which is fine. But our pelvic floor works within our whole body, right? So we want to know, how do we coordinate our pelvic floor with our breath and our movements and our abdominal muscles? All that kind of stuff is also really important.
Yeah, yeah. I love that. I think there needs to be a lot more awareness around this, because even when I first became a doula, like that's what I was told. That's what I had learned. And this was 10 years ago. And so I've learned like throughout the years that no, that relaxation piece is so important. And when it comes to pushing, if you don't even know how to relax your pelvic floor, then there's actually more chance for tearing and stuff. So um
That actually just reminded me, one other thing I wanted to say
okay.
is that people also hear about how many Kegels to do when they're pregnant, right? They'll say do 100, 200 Kegels a day, but that's like way too much, right? I mean, how many people are doing like 200 bicep curls a day? I mean, maybe some athletes out there are doing that, but the typical person is not doing it. So you actually don't want to be doing that many Kegels.
Yeah.
30, like maybe 40, like that's fine. Like you don't want to be doing too much, because that can make your muscle more tight than what you want.
You don't want to make it too tight. Yeah, you don't want to over strengthen, because it's muscles that we need for it to be able to relax, and and do both. So it's like a balance. And there's actually studies that show, I remember learning about this, that that athletes are more inclined to tear during childbirth because their muscles are so tight. And so I think especially for athletes, like working on those relaxation exercises for the pelvic floor are key for everyone. But yeah.
Yeah, definitely.
Okay, so what is one last message that you'd want to leave the audience with regarding postpartum recovery?
One last message. I think people just have to know that that they should be advocates for themselves is a huge thing. Just because they like we were talking about, there's such a lack of education out there, and it's no one's fault, right? You're not getting that education. But the more that you can learn, the more you can advocate, the more you can reach out for help, the more you're empowered you're going to feel with your own body, the more connected you're going to be able to feel. So I think that's really a huge message, is just like, really don't give up. If you're feeling something, if you're and in any way not feeling well, whether it's physical, emotional, don't give up, and then just be an advocate and continue to try to find the help that that you really deserve. So
yeah. Okay, so if anyone has any questions, they can either write now in the comments, or afterwards, once this recording is posted, anyone can put questions in the comments, and hopefully either I or Aliza can answer depending on the question. And then as far as reaching us, so you can see both of our Instagram handles. If anyone wants to reach out to me as a doula or birth education, or anything in that sense, then they can reach me through my website, laboroflovehouston.com, or my Instagram. And Aliza, how can people get in touch with you, and where can people find you?
Yeah, well, I have on my Instagram account, Rebound After Birth. I did start a business, Rebound After Birth, not too long ago. I don't have a website or anything, but I do have a Facebook business page, and I did start a Facebook group called Rebound After Birth Community, which Chaya is actually a part of.
Yeah,
and
it's great. I totally recommend everyone to join it.
Thank you. It's pretty new, maybe just a little bit over a month old. So I do live videos where I talk about things more, either physical things relating to like postpartum recovery and pelvic health and exercising and stuff like that. But then also, like I mentioned at the very beginning, I really like talking about more of that almost like mental health, like, you know, navigating that identity shift to becoming a mom and handling stress and things like that is also something I really like talking about. And we also do, I've started doing weekly live interviews with people. So all different types of health professionals that work in women's health. Like we just had one on self-care, and we spoke about menstrual cycles, and we have like tons more coming up. So it's, people are really welcome to join that group if they want to.
Yeah, and people can reach you through there, like if they want to get in touch with you regarding your treatment and education.
Through Facebook, either my personal profile, that's the Facebook group is through my personal profile, or my business page, Rebound After Birth.
Okay, awesome. Thank you so much, Aliza. This was so great. I loved having this conversation with you.
I'm glad to work. For people who joined later, we had a lot of issues with the technology in the beginning, which is why I'm holding my phone, and I hope it's not too shaky. But, this is great. Thank you for having me.
Yeah, I'm so glad that this worked out, and I'm looking forward to more people listening to it and hearing people's feedback. So please comment with your feedback. All right, I'll talk to you soon.